Simone Biles breaks down her breast augmentation, and we're going to break it down full throttle next. The great Simone Biles, Olympian, gold medalist. She's an incredible athlete. It's really interesting. She just came out and really detailed a lot about her experience with a breast augmentation. She must be a pretty outgoing person. She feels like she wants to share kind of her experiences because she kind of goes into a lot of detail. You know, I love all these people that want to, kind of hate on people when if they're doing plastic surgery procedures. More power to Simone. And she actually said that's just her, and that's exactly right. Just because you would never do plastic surgery doesn't mean it's not an incredible thing for many people. And I can tell you, for the procedures that I primarily do, which is breast surgery, those procedures change people's lives. It may seem incredibly insignificant to maybe an uneducated person or somebody that just doesn't know about it, but it makes people a completely different person, and it's a personal thing. So it sounds like it was important to Simone, and she goes into detail about this. And there's a couple things we'll talk about. She talks about her implant size. It's interesting. She said 310, I think, is what she used. I mean, she's a gymnast. I know they're not really big people. And I think she said she weighs about 105. It does, to me, seem like a little big for that size. Now, she does say that she thought it was very big initially, which is actually very common and should not worry patients initially, because almost all patients think they feel unnatural and big and kind of like they're wearing a push-up bra when they're not wearing a bra. And it typically is not a problem long-term, and it doesn't sound like it's a problem for her. But I mean, I'm not her doctor. I didn't measure her breasts. It's just that in the pictures that are there, and given the fact that she, is a relatively small statured person, it does seem like a little bit bigger implant. But at the end of the day, she's happy with it, and she's happy with her size, which is the most important thing. She does talk about her experience, and she actually says that she had a lot of difficulty in some of her recovery. She said she really couldn't do things without assistance for about 2 weeks, and had quite a bit of pain. It's not the typical experience that we typically deliver with a fast-track 24-hour recovery breast augmentation. In fact, that really has been things I've actually demonstrated that in 9 live surgeries around the world. We've written papers on it, and there's nothing secretive about it. But those patients are out shopping the day of surgery. They got to dinner, pick up their children under 3 years old right away, and they have an incredibly fun, easy experience with it. Now, obviously, it doesn't sound like Simone had that experience. Who knows? And there could be factors that come into that. But I do think maybe the first thing we talked about, the implant size, it all fits together. And this is called the process of breast augmentation. So that has 4 parts: patient education, tissue-based preoperative planning, which is picking the implant that fits the breast, then a refined surgical technique, precise dissection under direct vision, prospective hemostasis, and then defined postoperative care. And if you do those 4 things, it optimizes the outcomes of the procedure. But the byproduct is you can have this fast-track 24-hour recovery. I'm not sure how her surgery is done, how her implant was picked, but if any of those things are not done, then you may not get that fast-track 24-hour recovery. But if you do the process of breast augmentation, then you will see this fast-track 24-hour recovery in 99% of your patients. And that, our patients don't take narcotics. I think it's unfortunate that she sounds like a little rougher time with the procedure, but look, at the end of the day, she's very happy. She seems to be happy with her size, happy with overall experience now that it's over with. So more power to her. And the most kudos I give her is for really detailing this, because I think probably some of the things that she says are going to be useful for patients that are out there. So keep it full throttle, Simone. We'll see you next time.